Welcome to EM Pulse, bringing research and expert opinion to the bedside.
We're your hosts, Julia Magana
and Sarah Medeiros. Welcome back to EM Pulse.
Today, we're finishing off our series on growing a little human while working in the emergency department. And we're going to do this by talking about the next step, breastfeeding in the emergency department. Wait, before you turn off the podcast, because you think this doesn't apply to you, let me say you very likely have a colleague who is breastfeeding while working in the emergency department, or you will in the very near future. This, my friend, is your opportunity to learn from them and be supportive. You can be that person.
Jules, you and I have both breastfed while working in the ED, and tell me what that was like for you.
Well, it did stress me out to walk away from the pod and be tied to a pump for like 20 to 30 minutes. I also never really had a clean, comfortable place to pump, and many times crouched on a turned over trash can in a closet so that I could be close to the pod. And I am so excited to say that things are getting better, and we can honestly do even better. I hear so much support and see better rooms even with inside of my career. What about for you, Sarah?
Yeah, it was really stressful for me. I struggled with milk production, and so pumping was really important, but I also found it really hard to step away from clinical activities to go do this. And then, like you, I also struggled with finding places to do this. So in my first pregnancy, I was trying to do it in call rooms in the ED. I have done it in bathrooms and copy rooms. We used to have
bathrooms, really?
You do what you can, right? And our old pumping room, which thankfully is much better now, was a tiny closet that was also shared by our research assistants. And I remember being in there pumping, fully hooked up to my milking machine. And this 20-year-old, research assistant came walking in despite all the signs on the door and just kind of started chatting with me. And it was super awkward. So, yeah, this is a big challenge.
Yes, that is the room that I flip the trash can over to sit on every time. Fortunately, I never had anybody walk in on me, but I know the room well. And to be fair, we do have a better room now, and I believe that there is a better setup at this moment in time. And I think, as you're saying these things, Sarah, I hear a lot of similarities that we talked about with being pregnant while working in the emergency department, with breastfeeding while working in the emergency department. We feel that deep sense of responsibility to our patients, and yet many of us also feel a responsibility to provide breast milk to our babies. And there's a real tension between those two competing priorities.
Yeah, so let's dive a little deeper into this with our experts, Dr. Claire Abramoff and Dr. Shada Rouhani. Dr. Abramoff is an assistant professor at Jefferson Sidney Kimmel Medical College in Philadelphia, and Dr. Rouhani is an assistant professor of emergency medicine at Harvard Medical College and an attending physician at Brigham and Women's Hospital in Boston, Massachusetts. So in our last podcast, we discussed being a pregnant emergency medicine physician and all of the challenges of maternity leave. You make it through pregnancy and you make it through maternity leave, and now you have this beautiful little life to grow. So many of us do want to breastfeed our children, but that is a real challenge as an emergency medicine physician who doesn't get a lunch break, doesn't get any designated breaks.
Very true, right? Claire, tell us a little bit about how you became passionate about the topic of breastfeeding as an emergency medicine physician. Was there anything that kind of sparked that passion in you?
Yeah, so I have 3 children. They are 8, 5, and 3. I had my first as a second-year resident, and coming back to work after 5.5 weeks of maternity leave and trying to breastfeed was a experience that I think really initially sparked kind of my advocacy for this topic and trying to educate people and just work through how we can do this and support each other as emergency medicine physicians. One story that always stands out to me when I think about kind of my breastfeeding journey is when I was a brand new attending at Einstein. I think I was 2 weeks into my job and I was breastfeeding for my second child. And I didn't know anyone. I had just come off of orientation and I went to go pump, told everyone where I was. I just sat down, got everything attached when a second year resident who I'd never met before today comes knocking on the door going, Dr. Abramoff, a van just pulled up with 7 GSWs and we need you right now. And so frantically ripping pump parts off, putting my shirt back on and running into the trauma bay, just leaking everywhere, kind of stands out to me as just a special moment in my breastfeeding journey.
I think that really illustrates challenges that many of us had in that breastfeeding journey, as working in the ED and breastfeeding is always exciting. Shada, what about you? What sparked your interest and your passion in this topic?
I think Claire's story really illustrates well all of the challenges we face. I also have 3 children. Mine are 8, 5, and 2. And similarly, I found coming back with my first child that it was really hard to breastfeed and to get away to pump. And I also found nobody talked about it, and that made it so much harder. And so as time has gone on and I've gotten further along with my own career, I've realized that there is an opportunity to speak out about this and make it a little bit easier for people who are now coming up and having children and needing to navigate this on their own.
I think that's a really great segue into my first question. Okay, so all 4 of us have tried to pump in the emergency department here, so we can all probably come up with some challenges. But let's just say it out loud for those who have not had that experience. What are the challenges that people face when they are trying to breastfeed as an emergency medicine physician?
I think our challenges are really unique kind of in the House of Medicine because, like you said, we don't get a lunch break. There's no downtime. We don't have a schedule. So I think for me, the hardest thing is just the unpredictability of our job. And you never know if the 20 minutes you take to go pump is when the 7 gunshot wounds is going to come in or when the code is going to come in. And I think that kind of unpredictability and that inability to plan for when a good time to step away is going to be makes it really, really kind of uniquely challenging for us.
I think in addition to those scheduling challenges of getting away, there's real barriers that we face within emergency medicine culture. I think we often pride ourselves on being the people who are always ready, always there, able to be at the patient's bedside and monitoring them. And we feel bad when we step away for any reason. You know, whether we should feel bad or not is a completely different topic and one that we probably should think about overall from a physician wellness standpoint. But when you talk about breastfeeding, studies have shown that moms trying to breastfeed feel guilty and bad stepping away. And that cultural aspect of it, I think, is something that you have to call out and recognize as a barrier. And then there's logistics too. So for a lot of us, even just having a space in the emergency department or nearby that is dedicated, hygienic, private, so you don't get that research assistant walking in or the entire team showing up, that logistical aspect of having a space to use can be a barrier as well.
Yeah, and especially in the residency stage, if you're having kids during residency, which I think more and more people are these days, you know, the maternity leave, the actual time you get off is very short. And so, you know, coming back right after that short maternity leave and trying to juggle all of these things. And, you know, when your baby is still feeding every 3 hours, and ideally you should still be pumping every 3 hours, but trying to make that happen during a busy shift is a huge challenge.
Yeah, I felt a lot of internal guilt, what you were saying about how we pride ourselves on being able to be ready at any given time is a big part of my identity as well. And so I would feel really guilty, like, oh my goodness, what's going to happen if I'm in there and I have to, like, I can't be available in 5 seconds, you know? And I don't know, some of that may be real and some of that may be not as real. That might be some of my own expectations that I was putting on myself and my own self-importance in this process here. But I think sometimes we also get frustrated when other colleagues are not bearing their weight as well. And so I think that can also be a very real threat or challenge to the breastfeeding process as well, when our colleagues are not as supportive because they don't feel like you're like, why do you get to take a break every 3 hours or even once during a shift, whereas I don't get to take that break? You know, I think that can be a very real cultural phenomena?
I think the guilt that we place on ourselves and that medicine places on us as women and as parents really kind of impacts a lot of our breastfeeding journeys. I know a lot of us have guilt for taking maternity leave or for taking too long of a maternity leave, and then coming back to work and feeling like you're placing a burden on your colleagues when you need to step away every 4 hours to go pump. And like you said, not carrying our weight in the department. In emergency medicine, we're judged so much on our metrics, on our patients per hour, on our disposition times, on our door to needle times, and feeling like you're taking a break and stepping away and negatively impacting your colleagues can be a really, really hard burden to overcome.
Yeah, and just the time of life that this often happens, especially the first time that you're facing this, often you're a resident or a junior attending. And so I think those pressures are even greater in terms of, feeling guilty about calling on your colleagues to cover you. It's harder to do that as a junior physician. At least for me, it was harder and harder to call upon a senior male attending to cover you. Even if they didn't necessarily mind, I had a hard time doing that.
Yeah. I also think the length of our shifts is a kind of unique component of this as well. 10, 12 hours, and by the time you drive there to work and drive back, like sometimes I would honestly be 14 hours in between. And that length of shift makes it super challenging to succeed in this as well.
Totally. We work a variety of shifts at my current place. We're 8, 10s, and 12s, and it's so much easier to figure out pumping on an 8-hour shift compared to a 12-hour shift. And I feel like that is one of our kind of, again, a unique struggle of emergency medicine.
Yeah, I used to bring my equipment in the car and I would pump right before my shift and then go into my shift and then, try to get at least one pumping session during my shift. And then I'd have it in the car and pump again on my way home or before I drove home.
I feel like car pumping is it's the biggest recommended tip I give to like residents who are having kids or my colleagues is the car pump. Because if you pump at the beginning of the shift and at the end of the shift, then at least that's something.
I love that, Claire. It's the same thing. I tell people that all the time.
So we've identified a lot of these barriers. How do these barriers impact the ability for us to keep breastfeeding and to breastfeed well?
I think the bottom line is that all of these barriers make it harder to keep breastfeeding. And so as a result, a lot of people stop breastfeeding before they plan to or before they want to. And I think one thing I didn't understand before I had kids is the actual physiology of breastfeeding and why that pumping really matters. And if you've never had a kid, there's no reason you would know it. Our bodies make milk based on demand. And the number of times a baby nurses and how much they drink directly affects milk supply. And so when we're at work, the demand coming from the baby isn't there. And so the pumping is replacing that demand. And if there's barriers to getting away to pump, there's nothing telling your body that you still need to be making that milk. And so what happens to women is they notice that their milk supply goes down over time. And babies are pretty smart creatures. They figure out that all of a sudden there's not as much milk there. They stop wanting to breastfeed as much. And you get this vicious cycle that makes it harder for people to keep pumping because their supplies dwindle. When people face these barriers, they end up stopping breastfeeding earlier than they want to.
So what strategies can people use to overcome some of these barriers?
So I kind of look at it as the department as a whole needs strategies. You as an individual physician need strategies, and then your colleagues need to figure out methods that can support you. So I think probably the most important step is having a supportive department. And I think practically what that means is that they need to ensure there is a lactation space, a non-bathroom private area within the department for emergency physicians to use. Because as we all know, we don't have time to go to the NICU pumping rooms. We can't go to the lactation pod that they very kindly put in the lobby of the hospital, but that's not accessible for us as emergency physicians. And so I think the first step is to either advocate in your department or have someone in your department who advocates for a private space for lactation.
Do you guys have any other recommendations for departments specifically? Like how can departments set up policies or practices that can help to support our colleagues who are breastfeeding?
So I think one option is a flexible schedule for new parents who are coming back from maternity leave. I know at my department, we have shifts where there is double attending coverage or shift where there are more attendings in the pod. And it is so much easier to step away for a pump break if you are working a shift where there's another attending when the code comes in. Or we work at several different sites, and being at the site where there are more residents and more attending coverage to make it easier to step away. And then I think another thing, especially post-COVID, for us in academic emergency medicine, keeping things like faculty meeting virtual or having a virtual option so that people can stay home and breastfeed or pump on their schedule is also a really easy, practical tool in this post-COVID Zoom world.
Yeah, I would say if you're a department chair or leader, make yourself a breastfeeding friendly department. And little steps can really make a big difference. So policies like Claire was talking about, thinking about how you schedule attendings coming back, giving them the option to avoid single coverage shifts, or for academic sites, giving them the option to be on shifts where there's more senior residents rather than junior residents to make it a little bit easier to step away. Those things make a huge difference. And in the grand scheme of things, you're talking about a handful of shifts over somebody's career that you're offering them preferential scheduling for. And it's really very little downside. On the logistics side of things, normalizing breaks is important. And setting an example, if you're the department leader or senior in your department, of being very vocal and saying to somebody, do you need to step away to pump? I can cover for you. Setting that example sets a whole cultural tone within the department that others see. And then the place to pump, I think we've already talked about, but just to emphasize that again, you need something either in the ED or next to the ED. And obviously official lactation rooms are great and what we all want, but if you can't redo your ED right now to get an official lactation room within it, there's things that can be done to still support a space to breastfeed. At the end of the day, you need a space that's dedicated, that locks, that has an electric outlet and a table, hand sanitizer in it, and it ideally should be close to a sink and have a computer inside of it. If you can just create that space for people that lets them use it within their department or right next to the department, that goes a really long way.
And I would add, it's one thing to have a very basic lactation room, but if we're looking to kind of go above and beyond and make it a wonderful experience, put a fridge in it so we have a place to store our milk. I remember I was in the PICU as a resident breastfeeding, and I got very yelled at by a charge nurse for daring to put my breast milk in the refrigerator where their lunches were stored, because that was a biohazard, is what I was told. So having a fridge that we can use that we won't be judged for using. And then another really nice thing that one of the hospitals I worked at in their lactation room, they had hospital grade pumps for the physicians to use. And that was a really wonderful addition that they had that saved me from having to lug all of my pump parts and my giant pumps. And this was back when I still had the plug-in Medela pump. So that made a huge difference as a resident and just made it so much easier.
Yes, I was going to say that exactly. That's what I used as well. And it was also great because, if I was leaving the house at 4:00 in the morning or whatever, and I forgot to bring some supplies, I could actually access that at the hospital as well. I could get a kit and it fit with the hospital pump and I could pump there. So that was a huge help.
And a comfortable chair, not one of the stools that we wheel around in. If we're going to make it nice, give me a chair with a back.
Okay, let's take it down to the level of our colleagues. What can we do to support our colleagues that are breastfeeding? I think you mentioned one of them earlier is just offering to go and say like, hey, do you need to take a break? Can I cover for you? Like proactively doing that is great. Any other tips that you have?
I think that's so important, especially if you're working with learners or with residents as an attending. It can be really uncomfortable to ask a more senior person to take a break, especially as a resident or as a medical student who is pumping. And so taking the initiative to offer that, to say, hey, it's been 3 hours. Do you need to go take a pump break? Or not even asking them, just saying, it's been 3 hours. Go take your break, I have this. And I think that as an attending physician who has pumped, that's one of the more practical things I can do to advocate for my learners.
I have seen several learners that feel like they need to wear the wearable pumps and come out and keep practicing and pushing through that. What are your thoughts on using the wearables and integrating that into breastfeeding and pumping?
So I have kind of a controversial take on the wearable pumps. And for me personally, I found them very harmful to my breastfeeding journey. They did not work as well for me as the normal pump. But more importantly, I found that when I'm back in the department trying to see patients and pump, it really personally just decreased my output. I think because I wasn't in a good headspace then, whereas stepping away, sitting down, breathing, maybe eating my peanut butter and jelly sandwich while I pumped, for me, was much better for my breast milk supply and my pumping. I know that there are people who love them and find them game-changing in medicine. That is just my personal opinion. But for me, I really disliked trying to add them in, and I sold them immediately.
What I tend to tell people is that it's worth giving a try, but I had a pretty similar experience to Claire. I didn't find that they worked well for me. And so what I often tell people coming back to work is try them before you come back. Get a sense of if they work for you in your house when you're not trying to figure it out on shift with a lot of patients and nurses and everyone having things that they need from you. If they work well for you, great. But if they don't work well for you, then you can find another solution with time to do so.
And if you're going to wear them while seeing patients, practice bending over at home, because I know I personally spilled 2 full cups all over myself because I had not practiced the bend and did not quite realize that they were not very tippable.
Oh, that's a disaster.
It was.
I also want to emphasize what you said in terms of that importance of the headspace. So at the risk of oversharing, I really struggled with my milk supply, and I never tried the wearables just because I was already struggling. So I was trying the hospital pump. But even with that, I really needed to sort of be in my own headspace, close my eyes, and actually picture my baby. And that helped with my milk production. And, if I was having to see patients at the same time as, sort of wearing this device, I think it would have been really detrimental to my ability to produce milk.
100%. It's like I would always pull up pictures of my baby on my phone or FaceTime my nanny or my husband so that I could see my little baby while I was pumping. And that made such a tremendous difference for me. So I think it's really almost dangerous if we push for the wearable pumps too much, because I don't want people to feel like they have to use those. If that becomes the norm, that you don't need a pump break because you can wear the wearable pumps and keep seeing patients, I think that might be a dangerous trend for lactating mothers.
So my kind of tongue-in-cheek joke for learners that I'm working with that are breastfeeding is I tell them, if you come out wearing a wearable trying to see patients at the same time, I'm going to take that as a personal opinion that you think I can't see patients on my own or take care of a pod without a resident. So I will be personally offended.
And I do think, all of us are academic physicians, so we are a little spoiled in that we have residents and we have learners and we have other people at our emergency rooms who can kind of carry that weight and help us. So I do think it is harder when you are at a single coverage place where you don't have learners. I know during my 3rd pregnancy at one of our sites, we are either single coverage or with the PA. And that was a whole different kettle of fish than pumping at a busy academic trauma center where I have a million different people who can do tasks while I am pumping.
Such a good point. And I think that really takes us to that kind of next step of this question is, what other recommendations do you have for somebody who is contemplating coming back to work and pumping in the emergency department? What are some other tips that you have?
So I think on a practical note for me, one of the most helpful things was, and this may sound silly, but buying a million different sets of pump parts and stashing them everywhere. I'm a very forgetful person, and when you are pumping, you have to remember a million different things. I don't just need my stethoscope and my pen. I need my pump bags and the pump parts and the plug and the backup plug and my pumping bra and all of these things that I had to remember every single day. And I know at many stages I forgot significant parts and had to craft things together in the emergency room. So by the 3rd time, when I kind of had it down pat, I had a spare set of pump parts in my car that I never took out unless I had an emergency. I had a stash in my office, in my desk drawer. I had one in my locker. So I think I still have one in my locker, and I've been done breastfeeding now for 3 years. But you never know. You never know when you're going to need that emergency pump part. So for me, having redundancy was very important. I also learned where I could get pump parts in an emergency. Now, on my 3rd, DoorDash is wonderful. You can DoorDash a hand pump from CVS at any time of day. I learned that. The NICU and the OB departments are also occasionally helpful. Sometimes they're not as generous with giving hand pumps now as they used to be when I was with my first child. I don't know if it's because they now have to scan codes when they give out pump parts or what that issue is, but they have given me hand pumps in a pinch when I have forgotten things. And you can pay Uber to pick up packages or deliver things from your house. My husband called an Uber when I forgot my whole pump bag one time and had the Uber driver bring me my pump bag to the emergency room.
That's a really great tip.
I didn't know that was a thing.
I didn't know that either.
I had no idea. I was trying to get him to drive it to me, but he's like, Claire, all of the kids are asleep. It's 1 a.m. You just called me because you forgot your pump. And I think desperation bred some genius discoveries on his part.
I think other things, we talked already about the pumping on the way to work. I think that is huge. It's going to extend the time you can go at work without needing to pump. And so if you can find a way to do it in your car, and what that really means logistically is getting either a battery operated pump or an adapter for your car, a hands-free pumping bra. And I would just stick a nursing cover on. And then I would drive down the road pumping. But that meant that when I got to work, I was ready to go. And then two things that I think help. One is when you're at work, planning how you're going to pump from the start of your shift. And what that let me do is both have a rough sense of when I needed to get away and actually start managing expectations early. And I think this is something I got better at each time I pumped. Initially, when I first came back with my first child, I was pretty quiet about going to pump. And by the time I got around to the third kid, everybody knew I was going to pump. And that made it so much easier. Both because everybody knew I needed to step away. It gave me a chance to address things before I stepped away, make sure people had a plan for what to do next with patients. And then I found surprising advocates that way. I found that even at our community sites where we didn't have residents, I found the nurses to be great allies. And if the charge nurse knew I needed to get away and pump, she would say, you go, I'll deal with that patient. And that to me was incredibly helpful.
I think that communication about pumping in your schedule is so important. I remember I got a very harsh eval when I was a new attending when I was pumping for my second child, that Dr. Abramoff would frequently step away in the middle of shift and no one knew where she was. I was like, I was pumping. I told everyone I was pumping. You knew where I was. But after that, I would do what I would call my pre-pump rounds, and I would gather everyone around. We would run the full board. We would get dispositions where we needed to. We would come up with plans. I would give everyone my cell phone number and say, I am pumping for 20 minutes. We have a plan laid out. Call me if anything changes. And then I would give my number to the charge nurse and tell her where I was going as well. And I feel like that really helped just kind of set expectations and let people know exactly what was going on.
I got one of those evals too, Claire. I totally agree.
I was like, what do you mean you don't know where I am? I'm lugging my pumping bag around. You know I just came back from maternity leave. It's incredible.
But I think that also highlights there is still a big role for education and for normalizing this. And I do think that as we have more women moving into senior roles in the emergency department and just, full professors or, senior attendings, I think that it really helps to have those people advocating for the needs of some of the more junior colleagues. And again, this education piece, I remember, and this was years ago now, but there was a resident a year ahead of me who was breastfeeding, and one of our residency leadership actually told her she was going to have to make up the time that she was spending breastfeeding. And I think there was just a huge sort of lack of understanding on that person's part. They had not ever had to breastfeed, and so I think they didn't really know the challenges. And she was very clear about what she needed and why that was not okay. And it was super helpful for those of us in the classes below who were coming up and needing to breastfeed. So I think there's still a role for education, normalization. This is something that a lot of people are going to continue to have to deal with as we perpetuate our species.
So breastfeeding or pumping, say it loud, say it proud.
And I do think that it has become so much better. My oldest is 8 and my youngest is 3. And the different experience I had pumping for both of those children was just vastly different. I think part of it's I was at a different stage in my career. It was a lot harder as a resident than it was as an attending. But I think optimistically, I think it has become more normalized and that we're doing a good job kind of waving the lactation flag and making people aware of what we're doing.
A couple more practical tips that might be helpful. From a practical standpoint, when pumping in the emergency department, I think anything you can do to make it as efficient as possible is helpful. And this is the little stuff that people don't talk about, but things like having the hands-free bra, avoiding needing to wash your pumping parts in the moment. The official recommendations are to wash parts between each use, but many people agree there's ways around that, assuming the baby's healthy, full-term, immunocompetent. I personally would throw my parts into a Tupperware, then that would either go in the fridge or in a bag with ice packs, and I'd reuse them for up to 24 hours. And that saves a good 5 minutes. If you don't want to do that, you can use pump wipes, or you can have multiple sets of pumping parts so that you can just come home with 3 different sets of dirty parts, but not have to wash them. And then thinking about just your own basic needs and how you can combine those. So bringing food with you that you can eat while you're pumping, making sure that you have a huge bottle of water with you, those little things make a difference.
I think those are really great tips. And I love that efficiency piece that you're suggesting there.
I think the other tip is really around dealing with that mental block, because as we were saying, like, it's hard. It's hard to step away. It's hard to feel like you're letting down other co-faculty, you're letting down trainees, you're letting down your fellow residents or your nurses or your patients. And so thinking about strategies for yourself to help you overcome that mental block is really important. From a super practical standpoint, what I found helped me was just realizing that if anything ever happened, I could be back in the department in less than 2 or 3 minutes. And that's actually less time that it would take me to get to a different room if I was in the middle of a procedure and had to finish that procedure, degown, and go somewhere else. And just realizing that I could disconnect everything, leave it there, and run back was for me a little bit more reassuring. And then also talking to other people who have done it and getting that peer support can be really helpful, just at feeling like you're doing something that's okay to do. Because I don't think we can understate how important that mental piece of it is.
There's a lot of anxiety that comes with breastfeeding as a physician, and I think we all do this constant mental math when we are breastfeeding and working, where we're counting the ounces that we left in the fridge, and we're counting the ounces that we left in the freezer, and how many ounces we made on our first pump break, and whether or not there's going to be enough for the nanny to give the last bottle before I get home. And I think that anxiety that a lot of us feel when we're breastfeeding can't be understated, and I think can be really dangerous and really detrimental in an already shaky mental health period in a woman's life. I think it adds a lot to the postpartum depression that a lot of women feel and the postpartum anxiety that we go through. And I know I've seen friends who have been ruminating about their freezer stash or the ounces in the fridge or how they have to pump 4 ounces on this pump break or they're not going to have enough milk to send to daycare tomorrow. And I think that is just another one of these stresses and this pressure that we place on ourselves as physician mothers, and I think it can be really dangerous. So I do want to say that formula is not the enemy, and if you need to supplement, it is fine. It is healthy. It is natural. It is normal. And I think it is better to have a healthy, happy mom who is not ruminating about ounces and bags and storage than to give a couple bottles of formula.
Yeah, I think that's brilliant. I was hoping that's where you were going with that discussion, because it really does not make a difference in the grand scheme of things if you supplement with formula. That really, truly is not going to impact your child or mean that you are less successful in any way, shape, or form. And it may open the door for more success, in fact.
Yeah, and I supplemented with both of my children, and it was the right thing to do.
Yeah.
I was just going to say, I totally agree. I think there's a lot of pressure placed around breastfeeding, and I think maintaining perspective is really important. And I think this is, again, where talking to people really helps, because I think we often imagine everybody as having a flawless, easy, successful, happy breastfeeding journey. And I know very few women that that's actually the case for. I think almost all of us have had struggles along the way. My first child didn't breastfeed at all, and I exclusively pumped after many long nights of trying very hard to get him to and supplementing with formula. And I think just knowing that those experiences are actually the norm can go a long way to helping alleviate some of that anxiety that we face.
100%. We keep this all so secret, and we see the Facebook post about the chest freezers in people's garages that they have stocked full of thousands and thousands of bags of frozen breast milk. And you're so right. That is not the norm for most of us who have happy breastfeeding relationships with our children. And I think it's just we're all in medicine. We're all perfectionists. We're all trying to get the perfect MCAT score and pass the boards and get a great step 2 score. And we look at breastfeeding as one of these challenges. And I think perfect becomes the enemy of good, and we fixate too much on doing it right.
Yeah, absolutely. I think you guys are spot on with all of this. So thank you so much for joining us today and sharing your expertise.
Pulse check.
Being a breastfeeding parent while working in the ED is hard.
We are responsible to our patients and to feed our little humans at home.
It is physically uncomfortable if you don't pump regularly, and it can cause decreased production of that precious breast milk.
If you're a person breastfeeding, set the expectation with your team at the beginning of the shift. Set a schedule and do your best to keep it. Your call on the wearables.
If you are a colleague of a person who is breastfeeding, consider checking in with them to offer support. Give them space by covering for them while they pump.
And it's okay if this doesn't work out. Formula is okay too. It is not a failure. Fed is best.
As a department, create a culture of support by talking about pregnancy and breastfeeding. Develop and document supportive policies and provide a real space for pumping, not a half-hearted attempt to follow regulations.
You know, I would like to dedicate this episode to a colleague of mine, to both of ours really, Dr. Cece Hernandez. She recently matched into PEM and is pregnant now. And she's going to be starting fellowship right after giving birth to her first little human. And I know she's already worried about these issues. Cece, we are excited for this journey for you.
Also, a shout out to AWEM, the Academy for Women in Academic Emergency Medicine. This is a community of SAEM, and we put out a call for experts on their listserv, and we were overwhelmed with wonderful responses. Too many people to interview, so thanks to everyone for your support.
Well, that's it for our series. If you have not already, take a moment to subscribe and go back and listen to the rest of the series. You know, Sarah, it was a little stressful reliving all of those moments around growing a human while working in the ED. There are some good things and some really stressful moments too, and I'm so glad that we're moving forward as a specialty and doing this better.
Yeah, it's almost like a little bit of PTSD.
Yeah.
But thank you to our department for having a great pumping room now.
And thank you to OM Productions for having a studio that we can record this in.
So until next time, stay curious, stay inspired, and stay tuned.